Well, welcome back, everyone. I hope you had fun going out, and I saw a lot of people very active in the community, starting chats and responding to questions. So thank you all for participating there. Also, it looked like a lot of you were out in the exhibitor booths. Just a quick reminder for those of you as you visit the exhibitor booths, there are live bodies on the other end of those exhibitor booths. And so if you do have questions, a lot of them do have active live people sitting there waiting to answer questions. So please feel free to use the chat box on the right-hand side of the screen in the exhibitor booths. And then also for our speakers, if you do have direct questions for them, I see some of you are using the Q&A section within Whova within each speaker's meeting portal, and the speakers can see those questions. But if you do have a speaker or a question for a speaker that isn't being answered, please feel free to contact the speaker directly, or you can interact with them in their exhibitor booth as well. So welcome back, everyone. Just a quick reminder before I introduce Jeff that WCIF through our loyalty program is paying for lunch for our attendees today. So you have a $30 budget. Just a reminder, our policy doesn't allow us to pay per diem, but you do have a $30 budget to cover your food and any delivery costs. So as we will reimburse you up to that $30. So if you are going to be ordering lunch in, please remember to do that. Our lunch break will be at 12 o'clock and will run from 12 until 12:45. And then the afternoon session will start at 1:15. So that medium time, the 12:45 to 1:15, our exhibitors, that will be our final time in the exhibitor booths, although there may be some people hanging around to answer questions afterwards. So if you are going to be interacting with exhibitors, you can do that towards the end of that lunch break. All right, so with that, I would like to go ahead and introduce. One more thing. We have a leaderboard. So as you've been interacting in Whova, on the right-hand side of, the left-hand side of the Whova screen under community, networking table, sponsor exhibitors, as you go down a little bit more, there is a leaderboard. And so we have noticed that some of you are very, very active on the leaderboard, and we just wanted to announce that we will be giving some prizes to those who end up at the top of the leaderboard by the end of the conference today. So if you are at the top already, keep interacting, stay up there. And if you are wanting to win one of those prizes, please feel free to start getting even more active and earn more points for that leaderboard. All right, with that, I'd like to introduce Jeffrey B. Johnson, the owner of JBJ Insurance Group in Auburn, Washington. He is a specialist in Medicare legislation, regulation, and coverage. Jeff is a registered health underwriter and certified employee benefits specialist with 40 years experience in health insurance, education, and brokerage. After his 30-year career as an employee benefit consultant, Jeff started JBJ Insurance Group in 2010 to specifically address the needs of individuals who have retired or separated from their employment and no longer have employer-paid health insurance coverage. As an independent broker, Jeff represents multiple Medicare Advantage, Medicare Supplement, and individual health insurance carriers. He enjoys providing both regular workshops and one-on-one consulting regarding health insurance choices and for retirement and after severance from employment. So with that, I would like you all to join me in welcoming Jeff Johnson.
Kimberly, thank you for that great introduction, and welcome everybody to the Medicare Benefits Basics webinar. I have been doing this for many years. Maybe 15 years ago, I decided I needed to know something about Medicare because my HR directors that I consulted with needed to know what was going to happen when the baby boomers started showing up in the year 2011. And so I moved away from the group world to helping people in the Medicare maze. And so I'm going to actually turn off my video, and I'm going to concentrate on the slides because, hang on, this is a rapid fire Medicare Basics webinar that is going to go fast because there's a lot of ground to cover. What's important that you need to know is Everybody, virtually everybody, is going to make a decision for Medicare sometime in their life. And so whether it's you or your employees or your siblings or your parents, you know somebody as well as yourself are going to be making these decisions. So if you're 25 years old, it's a long ways away. If you're 62 years old, you're starting to pay attention to what's available for you. So I'm not going to cover every item in every slide. I'm sure you can read everything quicker than I can talk about it. But the point is, today, you can enroll in Medicare at age 65, but you can actually start taking your retirement benefit from Social Security or from other assets like a 401k, 457, or 403b50 B before that. And so a lot of times people say, what do I do when I retire early? Well, you have to go buy individual insurance or go on COBRA, or some employers have retiree plans. On the other end of the spectrum, some people don't retire. They just like what they're doing and they keep on going. But at age 70, they're going to get a Medicare card if they start Social Security. So just to let you know, anybody who starts collecting Social Security automatically gets Medicare Part A. So today we're going to talk about two big ideas. Number one, Medicare is a government benefit. And so the part of the slides that have the red, white, and blue talk about the Medicare benefits, and we'll talk about their benefit premium eligibility enrollment. And then the second half of the presentation, we're going to talk about your Medicare insurance options, which are available through the WCIF or through a Medicare supplement carrier or through a Medicare Advantage carrier. The big idea is you have choices. The three items after you enroll, your choices will center around cost, benefits, and network. So we'll be talking about all three. The two big choices that you have, if you look at this diagram where the word start is, we're assuming that you have already enrolled in Medicare A and B. So you've already talked to Social Security, you don't talk to them anymore, you enroll online. It takes 8 minutes to enroll in Medicare. It's really quick. We'll talk about when to enroll in Medicare in a few minutes, but once you're enrolled in Medicare, since Medicare doesn't pay everything, most people buy a supplement plan over on the left-hand column, and Medicare doesn't cover drugs, so you buy a Part D drug plan also. Or you buy a Medicare Advantage plan, which combines your supplement and drug plans and other benefits all in one. And again, we're going to be talking fast. You've got slides that you can pick up from the exhibitor booth on all this. So if you have them now or later, it doesn't matter. You can get those and just take notes right now if you wish. First of all, option number one is available to anybody in any location in the state of Washington. You enroll in Medicare, both A and B, and then you go out to the marketplace and buy a prescription drug plan and separately a Medigap policy. Or in your case, if you're part of WCIF, your retirees can get a special plan not available anywhere else in the market, and it combines the Medicare supplement and a Part D drug plan. And I'll emphasize this several times, the WCIF plan is the best plan you can get for your money because the drug benefits are so good on the WCIF plan. However, there's a cost involved with that good benefit. Option number two is a Medicare Advantage choice, also known as Part C. So when you sign up for Part C, you get A and B and a drug benefit. D, all in C. Does that make sense? So C equals A, B, and D. So that's sort of a math problem, I guess. You enroll in the government program first. You have to be in both A and B again. And then in the marketplace, you can choose a Medicare Advantage plan. In our state, the flavors are HMO products and PPO, which has an out-of-network benefit. The private fee-for-service and the Medicare savings account plans are not really sold in our Washington state, but you'll read about that. Now, my latest statistics from State Health Facts say that 31% of Washington Medicare eligible enrollees are in a marketplace plan, but a recent study that came out a few days ago said it's closer to 40%. So Medicare Advantage is really popping up on the radar here. Really quickly, Part A benefits are hospital benefits when you're admitted. There is no network. So the only way it's going to work is you have to go to a hospital that accepts Medicare. And I don't think I've ever found a hospital that doesn't accept Medicare. It's pretty common. Medicare's been around for a little over 50 years. The big issue here in bold is if you go into the hospital, you have to pay $1,484 this year each time you go into the hospital. If you go in 3 times, you pay that $1,484 3 times. They call it a deductible. We would call it today a co-payment because it happens each time you go in. And that number is adjusted for inflation. That's why on my slides I put the year in there, so I do a keyword search and adjust the numbers in future years. Part B is medical, also known as doctor coverage. So it includes your doctors and your specialists and your ambulance and your physical therapy and your durable medical equipment and your labs and your chemotherapy, everything outside of the hospital, but not retail drugs. It does include drugs given in the doctor's office, like chemotherapy, that's an infusion. Your cost will be $203 annually, and then you pay 20%. But key problem with Medicare, there's no out-of-pocket maximum. So you can go bankrupt paying 20%. So that's why most people contact me or another broker and ask about their options. Okay, Part D, drug benefit, we're going to cover the details in the second half, is the WCIF has a unique plan. We'll cover that. But for everybody else not buying the WCIF plan, there's 4 levels of benefits for prescription drugs. So your cost can be the full cost while you're meeting the deductible. Then you might pay $8 for a generic or $50 for a brand name and initial coverage. You go to the coverage gap, you pay 25%. You go to catastrophic, it drops down to 5% with no out-of-pocket limit for prescription drugs. And you can't buy 2 drug plans. If someone is enrolled on the WCIF plan and they go into their local pharmacy and they see a happy, smiling broker explaining the drug plans that the pharmacy accepts, hey, let me sign you up for one. When you sign them up, they kick you out of the WCIF plan. You can only have 1 plan at a time. So don't get into the trouble of trying to double up on some of these. The cost for these plans for most people for Medicare Part A is 0 because you've paid payroll taxes for 10 years or more. If you don't have 10 years or more of paying payroll taxes, you're going to pay either $259 or $471. Most people don't need to know about that. It's 0 for most people. For Medicare Part B, most people pay $148.50 this year unless you're high income. So if you're high income, that $148.50 can go up and up and up and up to $500. And there's an additional cost for your drug plan, $77. And so a lot of people find out if they're a high income and they're eligible for coverage through an employer or through their spouse, they usually have a better cost to stay in the group plan. And then when both spouses are retired, they go into Medicare because that's really their only option. What does it cost? Number 1, choice number 1 on the left-hand column. Anybody in the state, in any county can do this. You can buy a Part A for 0, your Part B to the government, $149, your drug plan average cost, $25, your Medigap plan average cost, $190. Add all 3 of those cards together, and your cost is $364 a month in the marketplace. The WCIF plan for the same Plan G and the low-cost Part B RX plan, those plan costs are going to total up to $533. So like I said, the WCIF is a little pricey, but it has the best drug plan available. and you have to decide if that's an option that you want to choose. And we'll cover the drug plan when we talk about private insurance market in a few minutes. Option number 2, Medicare Plan C. It's county specific. Not everybody can get this plan. This is what your friend Joe Namath is advertising on cable TV right now. You see advertisements all the time about these great Medicare Advantage plans. And yes, Part C line is correct. You can get it for 0 additional cost. So if you pay Medicare Part A, most people pay 0. Part B, $149. If you get a 0 premium Medicare Advantage plan, your cost is only what you pay to the federal government. But it's not 100% coverage like a supplement. And again, we'll cover that in the second half when we get into the private insurance market. Who is eligible? Most people are eligible at age 65, but most people defer enrollment until they retire because they're on a group plan. You can get it before age 65 if you have end-stage renal failure, or you've got Lou Gehrig's disease, or if you've been on disability, Social Security disability payments for 24 months. So if you add 24 months plus the 5-month elimination period for disability, that's where the 29 months of COBRA eligibility comes from. That strange number. Enrollment. Medicare is administered by CMS, and you enroll through Social Security or Railroad Retirement Board. I think in my 10, 12 years of helping people in Medicare, I think I've run across 2 people on the Railroad Retirement Board system. The most important thing you get today is on this slide, other than enrollment and cost issues, is when should you enroll? When should your employee enroll? Number 1, you can enroll during the initial enrollment period, which is 3 months before, the month of, and the 3 months following your 65th birth month. And your coverage always starts the first day of the month. So everybody has at least an initial enrollment period, and it only happens at age 65 unless you had an early eligibility because of disease or disability. You get a second one at age 65. The special enrollment period, the SEP, is for people who remain on their group plan. They can enroll any month they want on Medicare Part B. We're talking about Medicare now, not private insurance. They can enroll any month they want without a late enrollment penalty. I've had clients that are in their 70s and one at age 84 enrolled in Medicare Part B for the first time because those people were still covered by their group plan. So why pay for payroll deduction on group and Medicare? It usually doesn't make sense. If you didn't make it at age 65 and you weren't covered by a group plan, or if you retired and went on your world cruise, when you can do that again, and you finally come back and look through 6 months of mail and you realize, oops, I didn't sign up for Medicare, you can sign up every year, once a year in the first quarter of the year, called the general enrollment period, but your coverage is delayed until July 1st of that year. So you don't want to get caught in that. The special enrollment period allows you to enroll anytime within 8 months of the end of employer or union coverage. So I tell people, don't get caught in the COBRA trap. It doesn't matter if your employer is paying COBRA for 1 or 2 years or whatever deal you made with them. The government says if you're not employed actively and you're on COBRA, which means you're not an active employee or you're not working enough hours, you've got 8 months to sign up if you're age 65 or older on a group plan, on Medicare, and leave your group plan. And it's based on active employment, so retiree benefits don't count or special deals you make with the employer. If you enroll during the special enrollment period, again, there's no late enrollment penalty, and there's other special enrollment periods like you move to another state, you can enroll in the plan in that state. If your plan just decides to quit or they get kicked out by Medicare, Medicare will kick out an underperforming plan. Okay, moving on, we've left the government products and now we're going into the private insurance market. And we still have two options, except instead of the nice little picture, I sort of put it in the PowerPoint here. Option one, again, is original Medicare plus a Part D plan plus a Medigap plan. Option two is a Medicare Part C plan. No matter what choice you make here, original Medicare with a supplement and a drug plan, or the Medicare Advantage plan, you must be enrolled in Medicare Part A and Part B first. Okay, so the enrollment issues have a lot of rules. You have to time it right, and there's guaranteed issue. You can't get turned down, and if you sign up at the right time. The benefits I'm going to be showing to you are examples. They're not any actual carrier. And if you notice, I have not mentioned any insurance companies. There'll be no insurance company logos because this is an education meeting. Just to let you know, is that when you select a product, whatever it is, and if you use a broker like myself or anyone else who's certified to help people with Medicare, the cost is exactly the same if you go to the insurance company direct, go on the internet, fill out something in the mail, attend a meeting at Denny's, or talk to a broker. The cost is the same no matter where you get that product from, because by law, they have to offer the same benefit no matter how you enroll for it. Okay. Original Medicare, the drug plan. The drug plan is the key to Medicare. It is the most different from a group plan for most people. You need to enroll in your Part D plan when you're first eligible. When are you first eligible for Medicare? At age 65 for most people. So you should enroll at age 65, except if you're covered by a group plan. Okay. So once you leave your group plan, most employer plans are creditable. The key word creditable means your drug plan through your group benefit is at least as good or better than what's available from the Medicare Part D marketplace. Your insurance broker and your insurance carrier determines, or an actuary determines if your plan is creditable, and then you are required to send a notice out to individuals that are eligible for Medicare. And they are supposed to save their notice, and they get a stack of notices every year, and they go, I don't remember seeing a notice. Well, you tell them it was in the pile of the 45-page document I sent you, or you can provide them another one. But the reality is, if they sign up for an insurance plan after age 65, they have to tell the government that they were covered by a group plan. And that's about all they have to do. They just have to attest and put written that, yes, I was covered by a group plan, but they could be audited just like IRS can audit your tax report. If you get audited, you have to show them your credible coverage notice that the employer provided. Some high deductible HSA plans may not be creditable. And if that's true, make sure those individuals know they have to sign up for a Part D plan. Even if they're still covered by the group plan, because it's not creditable if they want to avoid the late enrollment penalty. And the late enrollment penalty is 1% of the national premium times the number of months they weren't covered. So most people today enroll in a drug plan, but when the just to let you know a little bit of history here. The Medicare Part D drug plan first started in the year 2006. So can you believe that? Medicare never covered prescription drugs until the year 2006. That is why the WCIF has a great plan, because they created a product before people could get a drug plan. So most legacy retiree plans have great drug benefits, and they look different than what you're going to see in this drug benefit example here. Okay. The standard, this is not WCIF. This is the Medicare Part C drug benefit that includes it with medical and hospital and everything else, or the separate Part D drug benefit in the left-hand column. Every drug plan in America follows this standard formula unless you're part of a legacy employer group insurance plan for retirees like WCIF has. There's 4 prices to your drug. The deductible price, which is the full retail cost. Initial coverage, again, there may be a tier cost, like tier 1 might be $1, could be 0. A tier 3 preferred brand name drug would be $50. A non-preferred is maybe $100. And unlike WCIF, when your total drug costs reach $4,130, outside of the WCIF plan, you go into the coverage gap, also known as the donut hole. And I won't cover the past history, but for today, going forward, your cost or your cost for your parents or siblings in the gap is 25% of the retail drug cost. So that drug plan, that drug that you were buying for $40 in the initial coverage phase, that retails for $400, your $40 drug becomes $100, 25% of $400 in the gap. And then when you have $6,550 in out-of-pocket cost and discounts for brand name, your cost drops down to 5%. So this is a little confusing. I've got a computer program. People can go to Medicare.gov and put their information in and find out what their costs will be in every category and what month they move from deductible to initial, what month they move from initial to coverage, and what month they move from coverage to gap. Are you with me? This is not the easiest thing to remember. So the WCIF Plan A has no deductible with the co-pays tiers showing right there. The WCIF Plan B does have a $445 deductible, and then you pay the co-pays that you see there. And the sample plan typically has a $445 deductible, but not all, but most carriers today have 2 generic tiers. One may be 0 cost, low cost drugs, and the next tier for a little more expensive drugs might be $3 to $8 probably. A preferred brand name at $47 is a common price you pay, and a non-preferred is 42%. But remember, after you get past 4,130, the WCIF, you still pay those co-pays, and the sample plan, you start paying 25%. So this is just, I'm not going to cover this slide. This is everything I just described to you. The important thing is the last line is there's no maximum benefit. You're not going to run out of benefits, and there's no annual out-of-pocket costs. I can get you a marketplace plan for a premium as low as $6.25 a month, or as high as about $100. So it's a little bit of work to explain the Medicare drug program. And believe me, I've done this for years, and people say, you know, I did go to college, or I was the benefit manager, or I used to run a company, and this doesn't make sense to me. I hear it all the time. What's important to know is that Medicare is not your group plan. And so there's a learning curve for everybody. And once you learn your options on Medicare, and once you go through a year or two and you see how it works and how your doctor works and everything, you're going to be on this product for 20 or 30 years. So once you learn the system, you get used to it. Oh, by the way, I got my Medicare card 10 months ago, so I just turned 65, and I've been on 2 different Medicare plans during that period of time. Okay, so option number 1, now we're going to go into the Medicare supplement portion of your benefit, and the government says you should sign up within 6 months after enrollment in Medicare Part B, and you will be guaranteed, no questions asked, you're going to get any Medicare supplement plan in the market you want, including the WCIF plan. That is a Medicare supplement, Plan G or Plan F. After 6 months, you can still apply, but you can get turned down. So they don't have to take you after 6 months. Notice it doesn't say sign up at age 65. Nope. If you're covered by a group plan and you sign up for Medicare Part B at age 72 when you finally retire, you've got 6 months to enroll in any Medicare supplement, also known as Medigap, same word. You've got 6 months to enroll. Everybody has to take you. All the Medicare supplement plans are standardized. However, Medicare always pays first, and the supplement comes in and pays second. They are letters, A through N, and Medicare Part A from the government is not the same as Medigap or Medicare Supplement Plan A. The key word is Part A or Plan A. So sometimes people mix that up. Okay. Very few people buy Medicare Plan A because it's the lowest Medicare supplement benefit. So key idea here is it doesn't matter if you do the ABC carrier or the XYZ carrier. Plan F is Plan F is Plan F everywhere. Plan G is Plan G is Plan G everywhere. The only difference is the cost and the color of the ID card and who you call for service, which is very rare. The Medicare supplement carriers don't add any extra benefits. They don't add dental or vision or hearing, but they do typically now, for competitive reasons, add a fitness club benefit. So I've highlighted Plan F and Plan G, and it's really quick. They're identical except for one box, the Part B deductible. And if I were in a room, I'd say, okay, who can tell me what the Part B deductible is? You don't have to go to chat. Okay. So it's $203. So the only difference between F and 3 in benefits is Plan F, you don't pay anything for A and B expenses. It's all covered at 100% when you're in the United States. And Plan G, your only obligation is the first $203, and then it pays your hospital at 100%, pays your co-insurance at 100%. And they both pay your Part A deductible at 100%. Now, insurance carriers can choose to offer any of these supplement plans. So you're not going to see every supplement offered from every insurance carrier. Medicare Advantage plans is option number 2. And they've been around since the late 90s. They were called Medicare Plus Choice plans. Key marketing term, in my opinion, Medicare Advantage. Doesn't that sound like the best option you can get? The Medicare Advantage plan. You're going to get an advantage. Well, what that really means is they're going to cover more than Medicare, and that's exactly what happens. Medicare pays the private insurance company that you select a fixed fee per month. And so the insurance companies are trying to get you in because they're going to get $500 or $600 every month. And that's how they can offer you a plan for zero. They're getting paid by the government. They're not giving you the exact same benefit. First of all, they are network plans. HMO plans are the most common, and they are what I call the economy level. And an HMO means you have to stay in the network unless it's an emergency. There is no out-of-network benefit. You can't even go to an HMO plan that you're signed up with in Washington and use the same insurance carrier HMO plan in Arizona. It may not work because you're out of area. That's you're covered for emergency. You're covered for urgent care, but not for sickness. Like if you're going to live in Arizona for 6 months and be a snowbird, an HMO may not be the best option for you. Little caveat, everything I'm telling you may have an exception. So I'm talking about general concepts here, not specifics. Your PPO plan have recently come into the market for Medicare Advantage in Washington State. They weren't here for a while, and now it seems like everybody has one. And a preferred provider plan adds an out-of-network benefit. So these are ideal for people who travel around the country, who've got grandkids in different states, and when they can travel again, might spend 3 weeks a month with them. They might get in their RV, they might have a house in Arizona, etc. And this usually doesn't apply to some people in the audience, but there's special needs plans. So if you're low income, you can get a special plan for people who are on Medicaid and Medicare both. Those are called dual eligible, and they can pick up a special needs plan, or they can remain on original Medicare. That's a choice. Everything is a choice, many, many, many choices. If you buy the HMO plan, you do not show your Medicare card to the doctor. You show your XYZ insurance card or your ABC insurance card, and the name of your doctor is generally on your card because they want you to have a medical home. You must use network providers, except in an emergency on the HMO. Here's a quick example. Again, I'm not going to cover everything, but most plans today have no deductible for doctor or hospital. The doctor visit could be $10, it could be zero. Okay. Specialist, maybe $50, $60 at the high end and $25 at the low end. The big difference here in Medicare Advantage in that supplement plan that pays 100%, as you can see, there's a copay for services. What I'm not showing you is it might be $10 for x-rays and $200 for an MRI and 90 days for $90 copay for emergency room, which is real good for people on Medicare, only $90. But the hospital copay is the big number on Medicare Advantage. You have to look at it as how much is it per day and how many days would you be charged. So a 5-day maximum doesn't mean you can stay for 5 days. It means you're only going to be charged for 5 days. So if you're in there for a month following a car accident, you're only going to pay $450 a day for 5 days on that low cost plan. They all have an out-of-pocket maximum, but that out-of-pocket maximum only applies to Medicare A and B expenses. Does not cover drug in the out-of-pocket maximum. The drug benefits included in here, but there's no out-of-pocket maximum on any Medicare Advantage, Medicare Supplement, or Part D benefit for drugs. Extras are like a health club, vision, hearing, and you can see some of the monthly costs, usually starting at $0 up to about $100. This is what Joe Namath, I used his name again, is advertising, but the benefits he's advertising are kind of all the possible options you can throw in Medicare Advantage all across the country, but they may not all be in a single plan. But they may be somewhere available, or they may not. Most plans cover telehealth and fitness benefits. Dental benefits could be only limited to $300 or $400, or they could be $1,000 or $2,000, depending on the plan. Eye exams and glasses, they may have a $100 hardware benefit, $200 or $300 hardware benefit. The carriers are starting to, these are Medicare Advantage only extras. Over-the-counter items, they give you $10 to $50 a quarter to order something through their mail order catalog. Aspirin, Band-Aids, thermometers, blood pressure check, ACE bandages, things like that. Meal benefit, no, it's not DoorDash. It's when you go into the hospital and you come back out, they're going to send you a box of frozen meals for 3, 4, 5, 14 days maximum. That's something like that. But we digress. We're going to move on here. We're almost done. If you look at Washington State, if you can see this image in here, there are 8 counties that are in gray, which means there are 0 Medicare Advantage plans available in those rural counties. But if you're in the Puget Sound area, you've got 40 to 50 plans to choose from. So again, it's very specific to the county. We're wrapping up here. Please emphasize when you talk to your employees about these great WCIF benefit plans that Medicare is also a plan that your employer provides because you're paying half of the Part A hospital payroll tax. So promote it. You're paying for it. Make sure you include it in your information when you talk about the great benefit program that you offer to your employees. The simplest way to provide the credible coverage Part D drug benefit is to give it to everybody once a year. You satisfy the requirement. Or you can figure out who's eligible for Medicare and their spouse and send it to just them in the fall every year. Don't sign up for Part A if you're going to make any HSA contributions. You cannot make an HSA deposit if you're enrolled in any part of Medicare. That's not my role. That's not the insurance company role. That's the IRS telling you their rule, okay? And again, don't stay on COBRA for 8 months. When you initially enroll, your Medicare enrollment will always be automatic if you retire before age 65 and you start your Social Security or Railroad retirement benefits. You will get a Medicare card at 65, or once you've been on disability for 24 months, you'll get a notice and you'll get a Medicare card in the mail. If you don't sign up automatically, and if you're self-employed, you really want to sign up during the initial enrollment period at age 65. If you're working past 65, but you don't have group coverage, if you're in individual coverage, you really want to sign up at age 65 during the initial enrollment period, just like I did. Most people that are working after age 65 are using the special enrollment period because they're covered by a group plan, and your employees will come to you and say, please fill this form out, and it's basically, is this person still working for you? How long have they been working? And are they on your group plan? And that's submitted with their application, and they get to sign up for Medicare without any late enrollment penalty. And as I just emphasized, the health savings account rule, the COBRA rule, and yes, you can retire, go on Medicare, and then go back to work, get group insurance, and cancel your Part B coverage. But I always suggest that you contact Social Security to discuss leaving and coming back at a future date. So several people I know have been laid off, and they were during COVID, and they don't really want to be laid off. They want to work for another 5 or 6 years. So someday you will have one of these cards. Just to let you know, the one on the left is the old card because your Medicare number was your Social Security number followed by a letter. And now the new Medicare cards are more secure because they're alphanumeric, 11 numerals or letters. So when you get Medicare, who knows, you may celebrate the occasion. And I was happy because I've been educating people for a dozen years about it before I got my Medicare card, but nobody gave me a cake. Anyway, we're done. Thank you for your time. You can talk to me at the booth, and I don't think we've got time for any specific questions right here, but you can always contact me. I am a source for multiple human resource departments, organizations, hospitals, financial planners, and so on. I get lots of calls. You can use these slides and hand them out to individuals if you want. That's they're not copyrighted, and or you can call me or have your employees call me, and I can help guide them through their choices. Thank you for your time, and enjoy the rest of the event.
Jeffrey, thank you so much. There was a lot of really great information. Again, head over to the exhibitor section of the HUVA site, and you can get Jeff's slides there. If you just scroll down his booth page, that JBJ Insurance Group page, just scroll down a little bit and you'll see the documents there, and you can print out his slide presentation. Thank you all. We are going to go ahead and close this session, and we will meet you if you head over to the agenda and click on the next session for cybersecurity. We will see you there in just a minute. Thank you.